We all at a certain point have experienced constipation or diarrhea. Hello everyone, my name is Misao Pauline, CEO LP Wound Care. Today I present to you a session about hemorrhoids. Many ladies, many gents are complaining of hemorrhoids. N'abaana bato nabo batandise. So, let's start off. What are hemorrhoids? Hemorrhoids are those strained veins around our anal area, around the anus and the rectum. So they are veins. We all know that each part of the body has veins. So these hemorrhoids come when those veins are overstrained. Then they tend to enlarge over to swell or kuzimba. So that's what we call a hemorrhoid. Basically, they are strained and enlarged veins around the rectum and the anus. So, what causes it? There is a picture down here that shows how hemorrhoids look like and their treatment. So, let's go to the types. There are basically two types of hemorrhoids. There are some that are internal and others that are external. The internal ones, majorly, you don't see it. The veins are inside. They don't protrude out. Zibeera munda mu rectum. And how you can know oziyina for the internal ones, I'm going to give the signs basing on the type. The internal ones, how you can know that you have them. Sometimes you feel discomfort while passing your bowel, while passing stool. You feel discomfort and pain. Other times you can see blood coming out, spotty blood on your stool. That is also a sign that they are hemorrhoids. Then another sign could be you feel irritation. In fact, before you see these things of blood, you feel pain. When the bowel your pain you might feel that swelling. Sometimes for the internal ones they might not show a swelling out. The swelling munda. So you feel irritation. Those are signs. Then for the external ones, they are visible. They are visible around the anal area. Oba oziraba. Oba era nezo strained veins oba oziraba nga zisaze. So, the signs you can see, they are similar because there is stool, having bloody stool, then pain while passing your bowel or passing stool. Then you can also feel irritation or itching around your anal area. Then you can see a swelling. You can feel something like a chimonde around that anal area. Oba nolaba strained blood vessels, physically sobola bulab. So those are the signs of hemorrhoids. So the other question is, how do these hemorrhoids come about? And which are the risk factors? How hemorrhoids come about, number one, is constipation or diarrhea. As I told you in the definition that these are strained veins. Extremely strained. Chiringa wogamba anti rubber band. Rubber band ebeera ne elasticity yayo. Naye era still with straining ennyo, it loses its elasticity and it gets what? Torn. Nechiyulika. So it is the same thing to our veins. Yes, they can contract and do what and relax. Still there are times they are overstrained. So if you have constipation, most time you pressurize that anal area, you overstrain it, leading to hemorrhoids. So the other cause is pregnancy. Pregnancy causes pressure on the rectum and the anus plus the bowel plus the bladder itself. So buli weteekako pressure ku rectum, veins zaawe era straining, of which the end result of extremely straining it is hemorrhoids. The other cause could be obesity. Obesity sigimanyiiko nnyo nange naye era bagamba obesity whereby if your organs nga extremely enclosed in fats, they can also overstrain what? The veins. Then we also have another cause of those hemorrhoids is age. Banamwe ebintu bingi ebijja with age. So causes tuzirabye. Kati tudde ku nzijanjaba or the treatment side. We have seen the causes. And in children, those children that abapama buno bubi obw'obutundutundu ate nga buba bukaluba, they're at a high risk of getting what? Hemorrhoids. So it's better you treat the constipation as early as possible. Still, even the diarrhea can cause what? Hemorrhoids. So let's switch to what? To treatment side. Number one treatment is diet, change of diet. First, identify what is causing this constipation. Kyekimulese omwana alya nnyo emiwogo, alya ebintu ebisiba olubuto byemumanyi. So we switch this patient or client of ours to vegetables, fruits, those soft things, bananas, biki ebyo ebintu ebigonda. Secondly, we encourage them to hydrate a lot, to take a lot of water, as plenty as you can, at least 2 liters. That is the least you can take in a day, at least 2 liters. Then if all that fails, there is a surgery they can do, the anal ligation. It's a surgery that can be done. It is quite expensive, but it doesn't take a long time, and wounds take a short time to heal. I, for one, have evidenced it being done. I've seen a procedure hemorrhoidectomy. So, pregnant women, Bambi, I encourage you to take a lot of water, and also as you're passing stool, I encourage you not to stay for long, because there is a quote always saying that hemorrhoids are common to people that take long in the toilet, like take long seated on the toilet seat. So that's hemorrhoid for you. There are creams and there are ointments that treat hemorrhoids. You can get them. I'll send one. I'll show you one here. So behavior, that's it. I remain Sao Pauline. I hope you won't care. Entrust us with your home care patients and we shall not disappoint you. Love you. Have a lovely day.